Good evening, one and all. I, Dr. Asawari Sawant, Public Health Specialist for IHW Council, welcome you all to the Breast Cancer Awareness Virtual Talk Show on the topic Dispelling Myths and Combating the Journey with Breast Cancer. This is an initiative of IHW Council and is supported by Roche. According to the National Cancer Registry Program report of 2020, the estimated number of incident cases of cancer in India for the year of 2022 was found to be more than 14.5 lakhs. Yes, that is a high number. 1 in 9 people in India are likely to develop cancer in his or her lifetime. In females, breast cancer is found to be the leading site of cancer. The incidence of cancer cases is estimated to rise another 12.8% in 2025 compared to 2020. With such high numbers of breast cancer prevailing in the country, there is still a lot of misinformation resulting in common breast cancer myths. Through this talk show, we will make sure that you know the truth behind these common misconceptions around breast cancer. To provide expert information on the same, we invite Dr. Mohit Agrawal, who is the Director and Unit Head of Medical Oncology at Fortis Hospital, Shalimar Bagh. Sir, we welcome you to the show.
Thank you, and a warm good evening and namaskar, and a warm welcome to everyone. And hope we would have a fruitful discussion, and we would be, dropping some myths which we have around this disease.
Definitely, sir. Thank you so much for joining. Let us start with the most common myths that we have around this issue of breast cancer, which is people believe that every abnormal growth is cancerous. Not only for breast cancer, they believe this, but for cancer in general. So let us start with this one. What would be your take on?
So see, any abnormal growth in the body is known something like a tumor, where the cells have increased disproportionately and multiplied disproportionately. There are two types, benign and malignant. Now, benign is just a collection of cells. You just need to make a diagnosis, and sometimes you do not need to do any intervention for it. However, if that collection of cells has a chance of invasion or a chance to spread to other parts of the body, then it is malignant. And these are the part which is known as cancer, and we need to be wary about that.
Okay, thank you so much, sir. So for what sir portrayed is that being wary of malignant form of cancer is the most priority, as well as if the cancer is benign, that is non-moving, you also need to get checked for that as well. Let us move on to the second most common myth, which is biopsies as well as surgery for cancer or detection can aggravate the cancer more. So, sir, there are so many people, including so many people in my family, which believes in this one. So, can you please clear out for people?
So I would agree with you, doctor, that this is one of the most common myths. And believe me, this is one of the biggest barrier to the treatments as well, because people feel that the moment a needle will be put into that growth or tumor, it is going to spread. But let me assure you that a lot of studies have been done, and it has shown clearly that doing a biopsy does not lead to any increased invasion of the disease. Secondly, why biopsy is important? See, when you have a radiological diagnosis of the disease, you need to prove it. In our country, where tuberculosis is so common, once in a blue moon we get a case where we suspect it to be cancer, we do a biopsy, it turns out to be tuberculosis. So to confirm the diagnosis of a cancer, we need a biopsy, which is absolutely safe. And secondly, in these days, we need to characterize the tumor, because we have gone far ahead in our management, where we need to treat the tumor as per its own characteristics, the tailor-made treatment. So a biopsy is must. And please people need to understand that biopsy is absolutely safe.
Thank you so much for enlightening us with that, sir. Definitely, detecting early is the best way to combat cancer, not just breast cancer, but all types of cancers in general. So, if you are not sure what the biopsy report is, that you are hesitating to get it done, please do not fear. Please listen to your doctor and your oncologist and get the tests done as early as possible so that the survival chances are as high. Okay, let us move on to another myth, which is if I do not have a family history of cancer, I won't get it. So there are so many people who believe that nobody in my family ever got cancer. That is why I am 100% safe of cancer. So, sir, what would be your take on this?
So see, most of the cancers are sporadic. Sporadic means that they do not carry a genetic lineage. Only 5 to 10% of the cancers, especially breast and ovarian, has some genetic or a familial linkage. So both the statements are true. That is, that if you don't have a family history, still you can get a cancer, which is the most common form of cancer. And also, I would like to emphasize that if you have a family history of cancer, that does not necessarily mean that one would develop a cancer. So either both of them are there. The only thing again is that if you have any symptoms or you are into that high risk zone, you need to consult your doctor for an early diagnosis.
Thank you so much, sir. So, we are talking about breast cancer, and so many people, majority of people believe that men are not liable to have breast cancer, and mastectomy is must for women diagnosed with breast cancer. So, these are two different questions. We would answer them one by one. So, the first one is men, because they do not have visible breast or fatty breast, so they won't be having breast cancer or they are free of breast cancer. So can you please enlighten us and clear this myth?
So actually, men do carry mammary tissue, but the amount of mammary tissue is much less as compared to any lady. Hence, obviously, a male breast cancer is rare, but it is there. I have patients whom I'm treating for male breast cancer, and they have to be treated. So any growth in the chest at the or around the nipple in a male is also suspicious, and they need to check with their doctor. So it is not that a male breast cancer does not happen, but because it is a scanty tissue over there, the chances are it is comparatively rare, what I can say. Coming on to the second part of your question, which was regarding mastectomy. Now, see, the breast cancer treatment involves three things, which is surgery, any form of medical management in chemo, hormone, or whatever targeted therapy, and a radiation. The treatment would depend upon the stage of the disease. And if I say that you are talking specifically about mastectomy, I'm assuming necessary that everyone undergoes a mastectomy, even lumpectomy is an option. However, if it is an advanced disease, patient might require some form of treatment beforehand. And in an very advanced disease, there is no role of mastectomy.
Thank you so much, sir. So our main advice would be there is no one solution that fits all. It would entirely depend on what stage you are on, where the affected areas are, and what all different options can be taken to treat your breast cancer. So please do not fear. Be open about these things with your doctor. Discuss with them. Ask if you have any queries. I am sure your oncologist would be able to answer you very well and clear all your doubts and queries. If there are different treatment options, they would portray it to you so that you have a better understanding what is required and what would be best in your case scenario. Okay, so let us now move on to another myth, which is a big myth which I have heard from my friends and family a lot, that wearing a bra can cause breast cancer. So, sir, can you please help us and enlighten us in this?
So there has been scientific studies, and there has been no study which has linked that wearing a bra, even an underwire bra, to a breast cancer. So it can be worked safely. There is no linkage. Be assured about it.
Thank you so much. And with strong words, emphasizing that there have been no clinical studies that have proven this, uh, it is safe to say that wearing a bra won't be the only reason that you have breast cancer. Another very common myth is using deodorants or underarm antiperspirants can cause breast cancer. So, sir, can you please help us with this one?
So, see, antiperspirants actually come with their own issues and problems. That is, that obviously they block the ducts. So sometimes there are more chances of an infection in the underarm area where you can have infection and all. But if you talk specifically in terms of malignancy or cancer, again, there has been no linkage of using an antiperspirant and increasing the chance of development of cancer.
Okay, thank you so much. So, sir, as many people are coming out and sharing their survival stories, many breast cancer survivors are also highlighting how they combat their journey. So, the one of the earliest and easiest way to self-detect is self-detection of breast cancer with the technique that they follow, in which you self check or somebody checks you signs of lumps in or around your breast. So many people have this myth that breast cancer always causes a lump which you can feel, and if you do not feel a lump, you are free of breast cancer and you do not need to get tested. So can you, sir, please help us in this myth?
So see, it won't only be a lump. See, a lump would only be seen when the breast tissue is soft and the lump is very apparent. Sometimes the breast is tense and the lump is deep seated. You are not able to feel it. Also, there might be a change in some morphology, like there might be an inversion of nipple, there might be a difference in the level of the nipples, there might be some sort of skin puckering, some swelling of the arm, or the swelling might only be in the armpit, not in the breast itself. Also, there is a form of disease known as Paget's disease, where you have skin changes in the form of eczema and the lump is absent. So I would say don't only rely on lump, and you need to be aware of your own body. And once the person is aware of its own body, any significant change would be noticed by the person, and then that is the time you need to consult an expert.
Thank you so much, sir, for so explicitly explaining us and also answering all our curious questions so far. Let us now move on to another very important topic that people need awareness on, which is getting tested. At what age do you need to get testing done for breast cancer? Is it important for women who are unmarried or have just reached puberty also to get tested, or is it just for older women? People are not sure about these things. And what all different testing methods would be best for somebody who just wants to get regular screening done?
Okay. So see, we are going to talk about a person who is at average risk. Average risk means any normal individual who does not carry a high risk because of prior history or because of family. Now, at that point, we have three modalities. We have a self-breast examination, we have a clinical breast examination, and we have something like an annual mammogram. Now, self-breast examination should start after the age of 20 to 25, where, as I have previously emphasized, that one needs to be aware of its own body. So, at every month, the person might see herself in the front of the mirror, where they can see any gross changes or examine herself through her hand. There is a technique for it, which I'll let you know. And also, during the time of bath, where the sensitivity of the skin is increased, any change noticed would be requiring the person to go to a doctor, who would then do a clinical breast examination in a expert manner to come out with any changes which are suspicious. Now, except for these, you have a very important screening protocol which is known as mammogram. Now, this mammogram is usually advised after 40 years of age annually, and it is nothing. It is just like an X-ray of the breast. Now, what I want to tell you important is that people feel screening is for patients. Screening is for a normal individual. It is for an asymptomatic normal individual. If a person is facing some problem, then he's undergoing a diagnostic modality. Screening is for a person who is absolutely normal. So every lady after 40 should undergo an annual mammogram to detect the cancer at an early stage where it is absolutely curable.
Thank you so much, sir. So, what you shared were, as you said, for average people who do not have any family history or prior incidences of cancer. So, can you please one by one clear us if there is any family history? By family history, which I mean for the viewers, is if your mother had breast cancer or cervical cancer or any other type of gynecological cancer, or anybody in your paternal side, your grandmother or your aunts were suffering from any sort of breast or gynecological cancer, what would be the screening protocol for such people having family history? One, and another would be for somebody who was had breast cancer previously or any other form of cancer previously and now has survived and has completed few years of survival.
Okay. So, see, again, coming to the point of family history, just having a relative with a history of breast cancer does not fit you into a high risk category. Usually, if you have two or more first relative patients who have been having breast or ovarian malignancy, then you are fitting into a criteria of high risk disease. Also, sometimes the patient has had previous history of an ovarian or a breast cancer, then you are at a high risk. Then a male breast cancer is something which is again a high risk feature. Then you have something like a ethnicity, like the patient who have a Jewish background, they are considered to be high risk. So there are specific criteria for the state. Now, if you have those high risk criteria, then your screening protocol would start early. So it usually starts 5 to 10 years prior to the first case which was detected in the family. So at that point of time, you will have to adopt a screening protocol, which would be a clinical breast examination. Also, something like an ultrasound of the breast might be required. Maybe a mammogram won't suffice because before the age of 30 and 40, the breast is dense. So mammography sometimes does not help. So maybe a specific modality like an MR would be required. But this needs to be individualized. So if somebody is fitting into high risk category, first we should know whether it is fitting into high risk category or not. Then we do a germline testing to know whether it is being carried in the genes or not. And thirdly, then we start a screening protocol, which is to be tailor-made.
Thank you so much, sir, for so nicely explaining it to our viewers. Let us now move on and continue with the other myths that we have around the same issue, which is annual mammograms guarantee that breast cancer would be found early. So what would be your take on this one?
So I would rephrase this myth, and I would say that annual mammogram is an excellent tool for early diagnosis. However, nothing comes as a guarantee. Guarantees are not there in this world. So again, emphasizing the point that screening is for asymptomatic individuals. I assume that these patients do not feel any changes in their body. So once you get an annual mammogram for such a patient, you are assumed to detect it if there at a very early stage, where in majority of patients this would be curable. So it might not guarantee, but it gives you an excellent tool for detecting it early, where you can have a better treatment, maximal chances of cure, and even save your finances because you will be undergoing minimal modality of treatment.
Understood. Great. So, to all my female viewers watching who are above the age of 40, 45, please do yourself this bit that as you gift yourself self-pampering sessions, spa sessions, or massage sessions, if you suspect yourself or anybody in your family that might have gone through form of cancers, get yourself a screening test done just to be sure, just to detect any chances of breast cancer or any gynecological cancer as early as possible so that the survival rates are best. Okay,
sorry, I would like to suggest, just to interrupt you, I would like to suggest to my all viewers that anyone who is fitting into this age group as what you have mentioned, their spouses should gift them as a part of their anniversary or Valentine a screening package. No, it's a very good gift. Believe me, it makes a good sense.
Definitely, sir. As we are approaching Valentine's and as February is also the Cancer Awareness Month, it is very fitting of you to, gift your spouses of this age a screening session, not to take it otherwise, but just to express that you care for their health and our men in the society are aware as well. Let us now move on to another myth, which is early stage breast cancer rarely occurs. Over to you, sir.
So, Dr. Suri, see, breast cancer evolves through a stage. Every cancer starts at an early breast cancer. When it is early, it is small, it will grow big, it will start involving the tissues around itself, and subsequently it will find a way to go to the other parts of the body. So every breast cancer would start as an early breast cancer, so it is not rare. Every breast cancer would start at an early breast cancer, and that is where the crux is. Pick it up at that point of time through screening protocols so that our cure rates increase. Believe me, if we pick it up at the right stage, we are going to prevent 70% of the mortality which is happening in breast cancer.
Definitely, sir. As a theme of cancer awareness through some years have been early detection for early prevention. That lies true in the case of breast cancer as well. The earlier you detect, the higher your survival chances are, and being aware is what helps you, pick up on these signs and get yourself tested as early as possible. Let us move on to another myth, which is breast cancer happens to only middle-aged and older women. And if you are young, you are free of cancer. There is no need to worry about it.
So age is one of the risk factors for breast cancer. As the one ages, the chances of breast cancer increases. That's absolutely true. But that does not mean that a young person cannot develop a breast cancer. So I have patients of breast cancer who are 20, 25, 30, even a girl of 17 years of age. So again, emphasizing the point that any changes in your body, if you notice them, just don't consider yourself for the fact of the age. You need to consult a specialist.
Yes, definitely, sir. So, another myth that has been prevailing is nausea, sickness, and pain are a part and parcel of cancer treatment, as often portrayed by Indian cinema and other cinemas as well, and TV dramas. That the cancer survivor going through chemotherapy sessions, it loses its hair, ages hundreds of years in matter of months, has poor bone density, has weight loss, as well as pain, sickness. So, this causes fear in a large amount of people, which then start fearing the word cancer in entirety. So I feel that the notion of highlighting cancer survivors and their journey is so much more important in our society, so that people are assured the cancer is just like any other treatment disease, and if you go through a proper round of treatments, the survival chances are not bad. So can you please clear this myth that nausea, sickness are very normal and you have to, bear with these?
So I would just say, as you said, don't go on hearsay. Meet the people who have already fought this disease. There is a big group, survivor groups, and you meet these patients and you feel so, you can see the enthusiasm in them, and they will tell you the actual truth because they have faced it. Okay, I believe, yeah, there are some challenges in the treatment. If someone goes under a knife for surgery, going to be some amount of pain. But the risks which the symptoms which you have talked about, people related more to chemotherapy. Let me assure to you, one of the biggest myths is that chemotherapy is very painful, while I would say it is absolutely painless. So meet a patient who's actually taking chemotherapy, ask him or her any disease. It is painless procedure. It is like giving an IV fluid. Now coming on to nausea and vomiting, there are different drugs which have a different propensity to cause nausea and vomiting. But these are the symptoms of 90s. We are in 2023. And we have such excellent drugs for it the patient, after even taking these drugs, do not feel any nausea and vomiting. Okay, whenever you take any treatment, be it a small antibiotic for fever, you face a minimal problem and that you expect it out. But it is nothing which is intolerable and something which is going to hamper the quality of life of a patient. Believe me, my patients take these therapies in their daycare and the next day they join their office. If they are feeling nausea, vomiting, and pain, how would they go to their office? So please do not go about people saying hearsay, meet an actual survivor and listen to their story.
Definitely, sir. Very nicely expressed. And at the same time, we keep on portraying such journeys of survivors on our channel as well, just to spread awareness that we are not in the age-old years as before, and medicines and science has advanced tremendously. If you have any issues or any doubts regarding this, or if you are feeling the same, please be open with your doctor, discuss with them. I am sure they would be able to guide you best and help you with all the issues that you are having. Next would be another very common myth that people have around breast cancer, as they do not know how to navigate breastfeeding with breast cancer. Many people believe that mothers who have caught breast cancer for any reason should not be breastfeeding. So, sir, can you please enlighten us on this one?
So I would say, see, if the patient is actually undergoing some form of treatment, be it a chemotherapy or a hormonal therapy, so the treating doctor would advise against feeding for the simple reason that those drugs might be secreted in the breast and we don't want the child to be exposed to those drugs. However, in a scenario where the patient has already been treated, is cured of the disease, and has subsequently had a pregnancy and is breastfeeding, it is absolutely fine to go ahead with the breastfeeding. There might be issues in getting the milk out of the same breast because of some vascular issues and all. Then they can use the opposite side of the opposite breast for feeding. It's absolutely safe. However, if you are going in active treatment, then at that point of time, I would really say it would be better to not to breastfeed.
Thank you so much for clearing that, sir. So, another myth is all breast cancers are treated pretty much the same way. And if you, get breast cancer at any stage, you would have to go through rounds of tedious treatment protocols, rounds of heavy drugs, which will cause you to age unnaturally, as well as many other things that people fear around this. So, can you please help us, as we have discussed before, that there are multiple different treatments, but can you please highlight on this topic again?
So let me tell you. So supposedly, if in my OPD I have two breast cancer patients today, which are of same age, height, and weight, and also the same stage of the disease, still they would behave differently. One might be getting cured of the disease, while other unfortunately might even succumb to disease. So in these days, stage is very important, but we are talking more about the biology of the disease. What we are finding out is how is the aggression of the disease, and do we have some specific drugs for that aggression. So breast cancer treatment is very personalized. It is personalized for an individual as per his height, her weight, her stage of the disease, and also the individual biology. So no two breast cancer patients are same. I would say, I would give an analogy like two kids being taught by the same teacher. One is scoring 90s, other is scoring 50s, though they are in the same class. So believe me, the breast cancer is the same.
Thank you so much, sir, for explaining us this so well and in such easy terms. Another very common myth that people believe is breast implants or breast augmentation surgeries in any way are very unsafe and can increase your risk for breast cancers. So can you please help us and enlighten us on this?
So since these surgeries have come into vogue, there has been some questions regarding whether they increase the chances of malignancy. But there is no scientific correlation as of now to suggest that is actually a matter of concern. So given and done in the safe hands, I don't find it to be a problem and increasing the chance of cancer.
Thank you so much, sir. Another very common myth or doubt that people have is women who never breastfeed are nuns or are not married are at higher risk for developing breast cancer. So, can you please touch on this? Help us enlighten how true is this and how false, if at all.
So, see, we need to understand that breast tissue is a hormone responsive tissue, and the female body has some hormonal cycles linked to her menstrual cycles, and there is a cyclical process going on in the female body. When a lady undergoes a pregnancy or something like a breastfeeding, these cycles are altered. And it has been seen and suggested by studies that if somebody breastfeeds, especially for a duration of more than 1 year, then the chances of breast cancer reduces. So maybe, so I would like to suggest that breast feeding is a very nice active process which has a lot of advantages. One, it reduces the risk of breast cancer, it increases the bonding with the child, and it is very helpful for the child's immunity and growth. So we should promote breastfeeding. However, to say that one who is not breastfeeding is at increased risk, I would like to rephrase it by saying that one who is actually doing a breastfeeding, especially for 1 year, is at decreased risk.
Thank you so much, sir. We completely understand. Another thing that people believe is when the treatment for breast cancer is over, you will never get breast cancer again, that you are completely free of it. So, can you please highlight this point and help us?
So I hope so. And I say majority of breast cancer patients would fit into this category. But see, any lady who has never ever developed a breast cancer also is at risk of developing a breast cancer. So 1 out of 8 ladies in her lifespan would develop a breast cancer, though they never had this disease previously. So once they have developed a breast cancer, obviously they are at a slightly higher risk. But depending again on the biology and the stage of the disease, 60 to 90% of the times they are curable. So obviously they will fit into a category that most of them will be cured. But unfortunately, few of them would still come into that category where there might be a recurrence. And there comes the importance of follow-up protocols where they need to meet their treating oncologists regularly, undergo screening procedures to see for early recurrence. And if so, treat it at that point of time.
Definitely, sir. Very wisely expressed. And time and again, we have been promoting this notion that getting tested, getting screened, and also checked regularly is very important in not just breast cancer, but all different forms of cancer if you feel you are susceptible to any. Another and last question for the day would be does abortion increase the risk of breast cancer? Are these two linked? What would be your take on this one?
So there was again in early 2000s apprehension that when you get an abortion, the chances of breast cancer increases. But this has been clarified by NCI, the National Cancer Institute, that there is no linkage between the two. So there is no association between an abortion and a breast cancer.
Thank you so much, sir. So, what would be your one advice or your tips for all the viewers watching for prevention on the breast cancer awareness month that we are in?
So I would say, see, we need to understand one fact, and that is that one needs to be aware of his or her own body, and early diagnosis is the crux. People feel that breast cancer is a death sentence. Why I would rephrase it that it is only a word. The only point where we are lacking is that we are picking it up at a very advanced stage. If we are, slightly proactive and people do not shy away from this disease and are willing to consult their doctors at the right time, we will be at a stage where we would be, eliminating this disease for the most of the part, especially breast cancer, what I'm talking. And as I've already told you, as sometimes ladies, especially Indian ladies, are shy. They do not want to undergo these procedures and all. It is the part of their counterpart, their spouses, to tell them that this is being done for their well-being, and as you have rightly put, that this shows that they care for them. So give them a screening package. This would be the best thing you can give them on any occasion, believe.
Thank you so much, sir, for clearing all our long list of queries and helping all the viewers enlighten and dispelling these trivial myths in and around breast cancer. As you rightly said, we are in the month of February, the month of love, as well as the month of cancer awareness. So it is a very fitting gift for your partners. Awareness around breast cancer is not just for the women in society, but also equally for the men. The main purpose behind such sessions is to make everybody aware on the different myths, the signs, the symptoms of breast cancer and different cancers, so that aware people are able to detect cancer early and increase the chances of survival all the early. So thank you so much, Dr. Mohit, for taking out time from your valuable busy schedule and sharing all this valuable information with our viewers. It was great having the conversation with you. Thank you so much. I would also like to thank Roche for the initiative and collaboration with IHW Council, and also to all our viewers for staying with us till the very end. I wish you all a happy February. And please do not take cancer as a very scary word. It is just like any other disease. And at right time and with right treatment protocols, everyone can get cured. Thank you.
Thank you, Dr. Shweta. Thank you for the value.